Good morning to the Honorable Ministers of the Council, members of the media, online viewers, radio listeners via St. Martin Gov Radio 107.9 FM and respective radio stations island-wide. I'm Rolika Roach and welcome to the Live Council of Ministers press briefing for today, Wednesday, May 8th, 2019. At this time, I invite the Deputy Prime Minister and Minister of Education, Culture, Youth and Sport, the Honorable Wycliffe Smith, to address you. Minister Smith.
Thank you very much, Ms. Roach, and greetings to all gathered here this morning, honorable colleague ministers, the Department of Communications, members of the press, as well as those listening and viewing via radio, television, and social media. Good morning, Sualiga. As you know, after Hurricane Irma, the government of St. Martin joined the Caribbean Catastrophic Risk Insurance Facility, the CCRIF, and we call it the CRIF. This means that the government of St. Martin is insured through CRIF for damages resulting from tropical cyclones. At this time, St. Martin's participation in the CRIF is financed through the World Bank. The CRIF not only offers insurance to member countries, but it also offers other programs and opportunities to its member countries. Consequently, programs such as their scholarship program and their facility to offer small grants are available to St. Martin as well. Through the CRIF University of the West Indies Scholarship Program, the CRIF provides scholarships to postgraduate and undergraduate students who are pursuing a study at the University of the West Indies in areas related to disaster management. Another program that CRIF offers is the CRIF Scholarship Program, which provides up to 4 scholarships per year for study in master's programs in areas related to disaster risk management at universities in the United States, the United Kingdom, and Canada, as well as at local universities other than UWI in Caribbean countries. Graduates of this program have gone on to work in national institutions in areas related to environment, finance, planning, development, and climate change. Applications for both programs are also available to us in St. Martin, and the deadline is June the 2nd, 2019. For more information on these programs, you can go to the CRIF website. Go to their home website at www.ccrif.org, and from there you can access all of their programs. Through the CRIF, a small grant program also is available, and this is available to non-governmental organizations, NGOs, community-based organizations, and charity organizations in St. Martin as well. Eligible projects should focus on disaster risk management and or climate change adaptation. And each project should fall within the range of $5,000 to a maximum of $25,000. The Small Grants Program accepts applications on an ongoing basis throughout the year, and these applications are reviewed quarterly. More information on this program can also be found on the CRIF website. Just go to their home website at www.ccrif.org, and from there you can access this program as well. In the last press briefing, I mentioned that I would be attending the second Caribbean Ministerial School Safety Forum in St. Vincent and the Grenadines, and that was held from the 29th through the 30th of April 2019 in Kingston, St. Vincent. The first forum was held in April 2017 at which time 12 countries signed the Antigua and Barbuda Declaration on School Safety in the Caribbean. At this second ministerial forum, 5 countries, including St. Martin and Curacao, signed on to the Safe School Initiative, thereby adopting the Antigua and Barbuda Declaration on School Safety. 10 ministers of education attended last week's forum. They were from, among other countries, St. Kitts, Dominica, Cuba, Curacao, Jamaica, and of course from St. Martin. The ministers were accompanied by advisors and officials in the education sector. Accompanying me were the Secretary General of the Ministry of Education, Culture, Youth, and Sport, Mrs. Shermina Powell-Richardson, and the Head of Student Support Services, Mrs. Olga Mussington-Service. The forum held in St. Vincent is a result of a United Nations conference that was held in 2015. At this particular conference, countries adopted a motion that called for the reduction of disaster risk and losses of lives, livelihood, and health after disasters. Out of this conference came the Worldwide Initiative for Safe Schools, and this initiative seeks to motivate and support governments to develop national strategies and implement school safety. I must say that, especially with the cooperation of UNICEF, St. Martin was able to participate in this regional ministerial forum held in St. Vincent. Within the schools and the education sector here in St. Martin, we are also advocating safe schools. There is a Safe and Emergency Management Committee in place that has already drafted a contingency plan with protocols for schools and for the ministry to follow. In addition, each school is finalizing its own emergency and safety plan. Via UNICEF, ministry and school personnel have received training, and more training in school emergency and safety is planned. The regional ministerial forums are held every 2 years, and St. Martin has offered to host the 3rd forum, which is scheduled to be held in 2021. With the hurricane season just around the corner, you may wonder what is the status of our schools here on St. Martin. As far as our public schools are concerned, we are nearing the phase when finally the urgent repairs to these schools can begin during the upcoming summer vacation. These repairs would be paid for by insurance monies. In terms of school repairs in general, the National Recovery Program Bureau with the World Bank will be assessing the schools that still need further repairs and reconstruction as a result of the hurricane. And the World Bank has allocated approximately $7 million for the reconstruction and for these repairs. We are expecting that the assessments and the engineering and building plans will be completed during the summer vacation as well. It is good to note that my ministry developed what we call an education master plan. This includes the reconstruction or new construction of buildings and facilities that fall under the Ministry of Education, Culture, Youth, and Sport. Included in this plan for reconstruction or construction are, for example, our schools, our sport facilities, and of course, also the library. We even included psychosocial programs for teachers and students. This draft education master plan was approved by the Council of Ministers and has been submitted to the National Recovery Bureau and the Steering Committee of the World Bank for their review. Given the fact that St. Martin herself does not have the finances for reconstruction and for new construction of educational, cultural, and sports facilities, we, that is, the Ministry of Education, Culture, Youth, and Sport, and the Council of Ministers, are hoping that the World Bank would really consider assisting St. Martin in this area. Talking about finances, it's good for the public of St. Martin to know that yesterday the Council of Ministers approved the national decree which regulates how schools are financed or subsidized. The laws regulating education all stipulate that the financing of schools had to be further worked out by the minister in a national decree entailing general measures pertaining to school financing or subsidy. Bringing laws and national decrees to completion is a very long and tedious process. The process for this national decree started in 2014, so 5 years ago. So it was not initiated by me, but it is my privilege to be part of the completion of this national decree. I want to thank my predecessors for initiating and guiding the process, and I'm grateful to be able to sign off on the national decree when it is put into effect. With regards to finances and education, I just want to remind you that next week the budget debates in Parliament begin. The Ministry of Education, Culture, Youth and Sport will be presenting a budget to the tune of a total of 123,406,326 guilders. This is approximately 25% of the national budget. Approximately 65% of the ministry's budget goes to pay school subsidies. Also interesting to note that the Department of Culture has been allocated a total of 2,763,378 guilders, and more than half of this amount, namely 1,097,100 guilders, that 61% goes towards the operation of the Phillipsburg Jubilee Library. With the limited financial means that the ministry has, we are all trying to do the best that we can. So tune in next week, God willing, to the budget debates and be informed as to what goes on in the Ministry of Education, Culture, Youth and Sport, and also in government. Thank you for watching and for listening, and I'll be available for any questions if you have any. Have a pleasant day.
Thank you, Minister Smith, for your opening remarks. At this time, I invite the Minister of Public Health, Social Development and Labor, the Honorable Emil Lee, to address you. Minister Lee.
Good morning. Thank you so much. Good morning, colleague ministers, members of the media in attendance, and those listening by radio, television, or internet. Again, good morning. I have three brief topics to touch on today in my opening statements. On May 15th, the Ministry of VSA is organizing an occupational safety and health awareness campaign. So this is an information session that is open to companies, employers, and employees, in particular in the construction sector. And this is a course or a discussion about occupational health and safety hosted by the Inspectorate of the Department of Labor Affairs. The session will be hosted at NEPA in Cahill from 5 to 6:30. And again, that's on May 15th. And the idea is really to inform, to educate, to explain to the construction sector in particular all about what kind of risks, job safety procurements, standards should be in place in order to reduce the risk of personal injuries. So what types of regulations are in place, what are the rules, the laws, and best practices. And this information session will have a number of speakers, including speakers representing SZV, the NRPB, Optima BV, NEPA, MIC-IT, and of course the Inspectorate. Again, as I mentioned, the idea is to educate the employers and employees in terms of what are the rules and regulations in terms of making sure that the work is conducted in a safe manner. The second topic I'd like to touch on briefly is this is Nurses Week. The International Nurse Day is May 12th, next week, but already we're beginning with celebration of Nurses Week. It's clear to me, as I've been minister for a few years now, that the public health care system really is driven and supported and carried by our nurses. And these nurses are involved in our healthcare system throughout, not only in delivering healthcare to patients, but also in terms of their positions in management, in policy making. We find that they're involved in the healthcare sector throughout all of the very different levels, and I've seen they really do a tremendous job. You know, some of you may not know, I come from a family of doctors. Actually, my mother and father are both doctors, and my mother's a pediatrician who had a private practice on her own for many, many years. And so I've grown up in and around hospitals and the medical field, and I've seen, you know, especially when it comes school time and children come in for vaccinations, and I see how much the nurses really do to really aid the process, comfort the patients, and you know, the work that I've seen them do throughout my life has really been tremendous, and I've always been very impressed. And so, again, thank you to the nurses in our community in all of the different levels of our healthcare system. Your contribution is very much appreciated by the country. Last topic. Yesterday I had the opportunity to attend the official opening of the urology department at the SMMC. The urology department actually has been open for several months already, but this is the opportunity for the official opening. For those of you who go by the hospital, actually, you'll see that there's a section of the hospital which was previously landscaped exterior space for the hospital, has now had a new construction, so there's a concrete structure there, which now houses the urology department as well as the neurology department. So we're making space for additional specialties coming into the island. And it is very much in keeping with the mission of the health tripartite, which is the hospital, the SMMC, the SEDV, and the Ministry of VSA, really with a very focused mission. And that mission is to deliver quality, affordable health care close to home. And I can see day by day that we're moving closer and closer to that. And I think that the official opening of the urology clinic is another milestone in that process. You know, and I commended the management, specialist, staff, and board of the SMMC for their commitment and dedication to improving the range of services, the quality, efficiency, and customer service. You know, it was interesting in the discussion and listening to some of the presentations from the speakers. This is actually the expansion and the addition of these services is funded by funding that came from the Bess Islands. It was an agreement that the hospital made with the Bess Islands that they would help to advance funding in order for the hospital to make the necessary investments to increase the range and quality of services, and that they would actually agree to an increase in their tariff or their contribution to help actually repay the loan. So in other words, they lent the money to the hospital to improve the range of services and also agreed to an increase in the rates at which they would pay that for those services so that they could repay that investment. And I am happy to report those investments are almost already paid off already, right? So what's the benefit to the Bess Islands? We're seeing it already. That means that their patients get a better quality of care. They don't need to travel so far. And actually, it was very interesting to note that the hospital is now working towards sending specialists to Saba and Statia in order to help to reduce their travel expenses. So I believe that it's a win-win partnership, and it's showing that we can improve the quality of care and also be more economically efficient and keep the money circulating in our economy. And those are very much key principles that we've had in terms of how we're evolving our healthcare sector. I'd like to thank Dr. Ramos and Dr. Rojas, the two urologists. The feedback that I've had from the community has been tremendous. And one of the things, and to our Minister of Finance, indeed, I think we are going to see, or we are already seeing, an increase in some expenditures regarding, for example, the urology department. We're seeing a number of things, actually. We're seeing that the referrals abroad have dropped way over 90%, which means that the money we're spending, sending people abroad, paying for plane tickets, hotel accommodations, and companions, is dramatically reduced. But we are seeing that because we've reduced the barriers to access to care, in other words, before if somebody felt that they had a problem, they maybe waited until it became a more serious problem because the process of getting referred and traveling abroad and approvals was a cumbersome process. And by making it easier for people to access the services, by reducing that barrier to care, we're finding that more people are going at a much earlier stage. And indeed, what the urology department is reporting is that they are finding more instances of people with early stage problems. In other words, cancer, but at an early stage. But what does that mean? It means that with the investment in the equipment, we can treat those things now. We can treat them at a much earlier stage so we maintain the people's quality of life. And what we're doing is we're reducing our long-term costs. So these cases which we're finding now, which are, yes, translating into some financial expenditures at a much lower level, and that money's being spent in our economy. But if we didn't, these are cases that would evolve into much more expensive cases in the future, much more complicated cases, and also at a point where people's health would be much more impacted by the illnesses then. So I'm very proud of the work that we're doing, and I'm very proud of the services that we're offering, and impressed. They demonstrated some of the equipment, or they showed us some of the equipment. They have new equipment coming in as well. They have ordered a laser which they can use for treatments. Again, these are all things that in the past we were sending people abroad, and instead now we're making those investments locally, and we're treating the people locally. And the skill sets, and this ties back to the nurses, what we're seeing is we're seeing the staff, the management, the specialists. Everybody's excited about the progress that we're making. And we still haven't seen the new hospital yet. So we're going to see this escalate on a exponential scale as soon as we begin with the actual construction. All of these referrals in the before were referrals abroad. Whether it was to the French side or to another country, it meant the whole administrative process, the application process. So it meant time, it meant cost. All of that administrative process costs the system money. And this is all money that we can save now and invest directly into our healthcare expenses. You know, one of the other interesting discussions yesterday is the neurology office was right there in the same new section. And yesterday alone, the neurology department saw 20 patients. All 20 patients would have previously been referrals abroad. So imagine, those referrals are now again that's money that's being saved. Instead of sending 20, maybe more, right? If it was more complicated, they would be sent with a companion as well. So somewhere between 20 and 40 patients that we would have had to pay for their travel expenses, their hotel expenses, time away from work, time away from family. All of that now we're doing locally in St. Martin. So I couldn't be more proud of the progress that we're making. And this is a progress that's the result of partnership between SZV, the SMMC, and the government. And I was very happy to hear that they were appreciative of all of the support that the government has been giving them in terms of their progress. So very, very pleased with the steps that we're making. And it's clear demonstration, another milestone, and proof that we are very much on the right track. And ultimately, that is our goal. Our goal is about improving quality of life and improving our economy here at home. So thank you very much.
Thank you, Minister Lee, for your opening remarks. At this time, I invite the Minister of Justice, the Honorable Cornelius de Weaver, to give his opening remarks. Minister de Weaver.
Thank you, Ms. Roach. Good morning, colleagues. Good morning, St. Martin. Just a brief note today. I'd like to begin by thanking the entire population of St. Martin for their well-behaved manner during Carnival. Now that Carnival is over, I want to thank you for being appropriate. I'd also like to thank the visitors who came here and visited as well and behaved orderly as well. But most importantly, I'd like to thank the police officers as well as the VKS officers, the ambulance department, the customs, the public health department as well, because they did a lot of inspections as well. And the real team effort, I believe, is one that has to be commended in keeping everyone safe, the food that they eat safe, but also the environment in which they party as well. I know the police officers also participated in Carnival, and I want to thank them for contributing in that way. But more importantly, throughout all of the jump ups as well as the parades, they did an excellent job in keeping it moving and keeping it safe. And I want to commend them because it was long hours, long days, and they were able to do this. And I want to really just tip my hat off to them and say thank you very much. Thank you.
Thank you, Minister de Weaver, for your opening remarks. The Minister of Finance, the Honorable Perry Hearlings, is present, however, will not be making any opening statements, but is available for any questions the media may have. We now move on to the question and answer session. Lyndon Brown of BCN TV, seeing that you are the only media personnel here, I will allow 3 questions. You now have the floor.
Good morning to the people of St. Martin. After a hectic time of carnival, Minister Smith, question to Minister Smith. Minister Smith, you was emphasizing the cultural aspect of carnival. Did you see the cultural expression on the street of St. Martin that you expected?
Thank you for your question. The Department of Culture organized together with the Carnival Foundation, the cultural parade, and also the cultural evening. And I think those went very well. Unfortunately, I was off island during that time attending the forum that I just talked about, so I wasn't able to experience it myself. But from reports that I received from the Department of Culture, the head of the Department of Culture, that everything went well, very well. Thank you very much.
Question to Minister Lee. Minister Lee, around us we are seeing a lot of measles in different various countries that they are encountering measles in their territories. What St. Martin put in place to check people at the harbor, at the airport, in case any cases will come our way?
Thank you, Mr. Brown. The ministry is in the process of making sure that all of our frontline people, so in other words, that the people at the ports of entry, but also that our family physicians are aware of what the situation is around worldwide. I think everybody's well aware of it, but just to ensure that, and also to make sure that they know what symptoms to look for, what to be aware of. As far as I know from the justice perspective, there's been no sort of regulation in terms of showing vaccination cards or anything like that, because it would really, I think, become a big barrier to our tourism industry and to entry. But so far, you know, knock on wood, we haven't had any incidences here to be of concern about. But we are monitoring the situation closely, making sure that the population is well protected. And of course, the ministry is also very active with their vaccination program. Recall that they had the health fair where they had vaccines available for people. But the population, we certainly encourage everyone to make sure to verify that they've had their measles shots updated. And for example, when I just recently traveled, I made sure that my son's vaccination records were up to date. And so I think that's a responsibility that everybody in the community has, is take the time, make sure that your family and your children are up to date with their vaccination records. It's shown clearly worldwide that if you maintain your vaccinations, we shouldn't have an issue here.
Question to the Minister of Finance. According to estimate, over 4,000 visitors came to our shows, and that means a lot of tax for St. Martin. How is the financial status of St. Martin?
Thank you, Mr. Brown. Good morning to my colleagues, to the people of St. Martin and the press corps, of course. We are still busy collecting the data on that, but on the visitor side, I don't know where you got the estimation from, but
From the Minister of Tourism.
okay, then we are getting that data together to see what the impact was. That will take some time, but the financial position of St. Martin is still promising. Of course, we still are combating a deficit on our budget, but I can inform you that the income over the month of April, as was budgeted in the 2018 budget, that we have surpassed the income this month. So it's going well. The income mostly is, of course, from the TOT and the profit tax, but it is a substantial amount that we went over the budgeted amount. So again, it confirms my firm belief in the beginning of my tenure as a Minister of Finance that we see progress and we see kind of the recovery, financial recovery going on. And in light thereof, I always mention that I have a positive outlook for the direction that we are going. And in light thereof, we are busy with the tax reforms and the financial, public financial management reforms. And that should result within 2 to 3 years to a significant improvement on our budget. And I refer with that to my financial recovery plan that we are still on track for a balanced budget in 2020 or 2021 and a surplus the year after. So thanks to the resilience of the people of St. Martin and the businesses that we are moving forward. Thank you.
Thank you, Mr. Brown. Thank you, ministers. Honorable ministers of the council, members of the media, this radio listeners and online viewers, this brings us to the end of the live Council of Ministers press briefing for today, Wednesday, May 8th, 2019. For rebroadcast, tune in every evening at 7 p.m. on St. Martin Cable TV. For video on demand, log on to the official government's website at www.stmartingov.org. On behalf of the Department of Communication, I'm Relika Roach, and do have a pleasant day further.